More than half of American counties have no intensive care beds, which poses a particular danger for older patients who face the highest risk of serious illness or death from the rapid spread of COVID-19.
Healthcare analyst Dr. Katie Jarvis is on the KOGO News Live line. Thank you for joining us, Doctor.
Thank you for having me.
So here in San Diego, that might not be an issue yet, though the pressure on the medical system is high, but smaller cities in California and across the country may not have enough beds. The question is, are older Americans in danger?
I think that they are very vulnerable and at high risk of needing ventilators, and I think we don't have enough.
So, what is the worst case scenario here?
So we're doing several things to try to handle not having enough ventilators in other parts of the country. For example, in New York, they are actually daisy chaining ventilators together, or people together on one ventilator. So multiple people using one ventilator.
What is there? I'm sorry. Is there a danger of cross-contamination there?
There is. Now, most of the people who are on these ventilators already have COVID-19, and you can put filters between them to catch the virus.
But if they already have it, it seems not that it is obviously something that you want to do, but are we making enough ventilators to get them out to these hospitals?
Well, the problem is the amount of time that it will take the automakers to retrofit their factories to create more ventilators. So they're certainly ramping up as fast as they can, but still it's a timing issue. So there are, for California, for example, the number of deaths is expected to peak in 25 days.
Okay, so...
Ooh, that scares.
Now, here's the fear of a lot of people with their parents, their grandparents, is that if it came down to it, an ICU bed, a ventilator, and a 40 or 50-year-old came in, as opposed to an 80 or 85-year-old, who's going to get the bed?
Right. So those are very tough decisions. I think a lot of hospitals are choosing, in Italy, they're having to make those decisions already. And a lot of hospitals are choosing to give the ventilator to the younger person who has a higher likelihood of surviving using that ventilator. I hope I don't have to make those kinds of decisions. I certainly would try connecting multiple people to one ventilator first. Also, pet ventilators are something that we don't think about very frequently for humans. But a horse or a cow that goes through a surgery needs to have a ventilator. I would rather try that than have somebody die.
Boy, and it looks like we have a real dearth of ICU beds as well. So it's not just this critical medical equipment, but it's actual beds?
It is actual beds as well. We don't, the problem is we don't have enough beds in hospitals just in general, I think, to handle this problem. We do have enough hotel beds in America, and in the setting of social isolation, we could use the hotels for hospital rooms. The real question becomes, though, you don't have suction or oxygen or some of the things that you would typically have in a hospital, but we could bring in portable versions of that. So I think that would be better than nothing.
Is there a chance that we could use medical equipment from the U.S. military to do this? I know that we're deploying essentially MASH hospitals around the country.
Yeah.
It seems like the military would have some extra equipment that they could share out.
Sure. So the government does have a stockpile called a Strategic National Stockpile that is handled by the CDC. And back a few years ago, they had about 12,700 ventilators. There are estimates that they have about 20,000 ventilators. They've already deployed some of those ventilators to New York. So they're starting to use those ventilators in the Strategic National Stockpile. Also, the National Institute of Health has animals that undergo surgeries for types of research, and so they may have some pet ventilators as well. Then we have the U.S. naval ships that have some ventilators on them. There are 2 U.S. naval ships that are hospital ships, basically.
Well, Doctor, it sounds like we're going to have to get creative here. Healthcare analyst Dr. Katie Jarvis joining us on the KOGO News Live line. Thank you so much for the information. Very interesting.
Thank you.